Hi everyone, welcome to our channel. In this video, I'm going to explain about the dry eyes. Generally, in human beings, eyes produce a tear film which helps to protect the eye from damage. But in certain conditions, eyes do not produce the enough tears, or the produced tears may dry out quickly, leading to the dryness of eyes. This dryness of eyes are usually seen in people who fly or in aeroplanes and people who live in AC rooms for longer time, and also while riding a bike or car. Generally we'll see this dry eyes, and it is most commonly seen in people who look or watch TV, computer or mobile for a long duration or long time. We see this dry eyes in these conditions. Now we're gonna see what causes the dry eyes. Before seeing this, I just want to tell about the tear film. The eyes produce the tear film which contains three layers. That is the outer fatty layer, which is produced by the meibomian gland. It keeps the eye from drying up too quickly. Second is the aqueous or watery layer. This layer is produced by the lacrimal gland, which is the maximum part of the tear film. And third is the mucus layer, which is produced by the conjunctiva. It keeps the tear film or the eye moist. Now we're gonna see the causes of dry eye. As it was explained earlier, dry eyes may occur because of the decreased tear production. Decreased tear production is usually seen in conditions with aging. As the age progresses, tear production will be decreased. And also in conditions with Sjogren's syndrome, allergic eye disease, rheumatoid arthritis, lupus condition, scleroderma, and also people with diabetes, there will be decreased tear production. It is also seen people who are taking medicines like antihistamine, cold tablets like decongestant, hormone replacement therapy, people who are taking diuretics for longer duration. In these conditions also there will be decreased tear production. And other cause of dry eyes is increased tear evaporation. As already told, the outer fatty layer, that is the oily layer, is produced by the meibomian glands. Any problem associated with the meibomian gland which is present or located at the eyelid, in these conditions there is increased tear evaporation causing dry eyes. Conditions like blepharitis, people who have less blinking rate, like people who watch screens time like TV, computer, mobile for longer duration, people who read for a long duration in driving, and also in Parkinson's problem. In conditions where there is dry air around us or in the room, if any problem associated with the eyelid, we come across this dry eyes. If the person has dry eyes, the person may experience symptoms of dryness of the eye, some burning sensation in the eye, and also the person have a sensation of having something or the foreign body in the eyes. The person has sensitivity to light. There will be eye redness. If the person wears the contact lens, there is difficulty in wearing this contact lens, and there is difficulty with the nighttime driving, blurred vision. All these problems will be seen with the dry eye. If you experience this kind of symptoms, please consult the eye specialist, that is the ophthalmologist, where the doctor examines the eye. The doctor examines the eyelids, the surface of the eye, the blinking rate, etc. And also doctor may suggest to undergo certain tests like slit lamp examination. In this test, the doctor provides a light into the eye and uses a microscope to examine the eyelids, etc. Other test is a shimmer test. In this, a tiny piece of paper is placed along the edge of the eyelid and this paper is left for several minutes. With this test, we'll see how much tears are produced or how much paper is covered with this tears. Other test is tear breakup time, T-BUT. In this test, we can diagnose how quickly the tears evaporate. In this test, doctor places a dye into the eye, then doctor checks how long the tear film remains stable with the microscope. Less than 10 seconds, it indicates the dry eye. Coming to the treatment, if the person has dry eyes, doctor may suggest with the artificial tear drops in the initial stages. In the later stages, doctor may suggest for placing punctal plugs. Generally, if there is excess tear or water film in the eyes, these excess tears will drain out into the nose with some opening. With the help of punctal plugs, we prevent the draining of tears from the eye so that we can save the tears. This is one method of treatment. And the other method is LipiFlow. We call it as thermal pulsation therapy. Usually it is indicated with meibomian gland dysfunction where a thermal pulsation is used which gently massages and warms the eyelid and stimulates the meibomian glands to produce the oil. Other method is the intense pulse light therapy where the doctor uses the pulse of light to stimulate the meibomian gland and also releases the blocked gland to release the oil. This is all about the treatment option for the dry eye. We can prevent the dry eye by avoiding hot air into the eyes, by avoiding the hair dryers towards the eye, and also we should keep our room moist by using a humidifier. And when we go outside, we should use the sunglasses to protect the eyes from sunlight. And people who have a longer screen time, like watching movies or watching TV, laptop or mobile for a long time, they should follow the 20-20-20 rule. That is, for every 20 minutes they should take a break, and for 20 feet they should watch an object 20 feet away for 20 seconds. This is that they should follow this 20-20-20 rule, and we should stop smoking. And if the person has dry eye, they can follow this home remedy, like we should place a warm compress over the eyelid, and after placing the warm compress for few minutes, we should gently massage our eye. It can reduce the eye dryness, and also using omega-3 supplements also prevents the dry eyes. If the dry eyes are not treated in a proper time, the person may have some complications like eye infection, eye damage, reduced vision, etc. This is all about the dryness of eyes. Hope you like the video. If you like the video, please share and subscribe our channel. Thank you.